Hello, everyone. Thank you so much for joining me on this program, Focus on African Women's Health. This is a program that is dedicated to promotion of African women's health at home and abroad. We share the global message of health for all and emphasize that African women must not be left behind in optimal health. In case you are joining this program for the first time, my name is Dr. Olayide Bushiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. It's another beautiful Monday morning, and I thank you again. Last week, we started our conversation on cervical cancer and provided some background information. The focus for today is on its prevention. And there are two core areas that I will direct our attention to in terms of its prevention. Number one is the cervical cancer screening, and the second one is that of lifestyle issues that we need to be aware of. So let's take them one after the other. Firstly, what is cervical cancer screening and who is it for? Cervical cancer screening, many times referred to as Pap test or Pap smear. It is for every woman with a cervix, every woman that is aged from 18 years up to 69, and who has been sexually active, even if it is with just one partner. It's a simple test that takes only a few minutes and detects changes in cervical cells. In the course of the test, cells in the cervix are collected and are tested. This test can be done by doctors or women's health nurses. It may feel uncomfortable, but it's important for a comfortable life. It's effective in preventing about 90% of potential cervical cancer cells. Perhaps you find it reassuring, but I think it's important to also say that over 90% of Pap tests are normal, they come out normal. In case you are listening to me or watching me from Australia, in Australia, with effect from December 2017, the new cervical screening program came into effect. And this new screening program looks for human papilloma virus, which causes almost all cervical cancers and not just abnormal cells, as previous program used to. In this new cervical cancer screening program in Australia, the first test is done at the age of 25 rather than age 18 to 20 in the previous program. And after the first HPV test is done, you only need to be screened every 5 years. After the first screening at the age of 25, in the Australian context, one only needs to be screened once every 5 years. And you may be thinking about the cost. Women who are eligible for cervical cancer screening do not need to pay for the screening. However, it's important to actually find out about the cost at the time of making the bookings. Now, let's look at those lifestyle issues that we need to be aware of. Number one on the list is the need to maintain regular physical activity. It's important to ensure intake of healthy dietary. And the third one on the list has to do with the issue of limiting alcohol intake and avoiding tobacco smoking. And as we round up to this program, there are 3 action points that I want to direct your attention to. And the first one is make an appointment with your doctor or women's health today and have a regular Pap test. If in Australia, every 5 years, and please find out in your own country or wherever you are listening to me. And the third action point is maintain a healthy life, a healthy lifestyle. And that is it for me for today. Thank you so much. If you are joining again and you are wondering who is speaking, this is Dr. Olayide Bushiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. Next week, we'll be looking at mental health. So please join me next week, and I really look forward to our time again when we shall meet on this program focused on African women's health. Please watch this video, share it, and let's together promote the health of African women. Thank you again, and it's bye for now.